and welcome. My name is Anissa Ali, and I work for Futures Without Violence. So we're here today to hear more from this year's recipients of the Linda Saltzman New Investigator Award, which is presented at the National Conference on Health and Domestic Violence. So the Linda Saltzman Award is co-sponsored by the CDC Foundation, Reliance, and Futures Without Violence. And it recognizes an outstanding new investigator working in the field of intimate partner violence, sexual violence, teen dating violence, and related issues. The Linda Saltzman Award honors the legacy of Dr. Linda Saltzman, whose groundbreaking work at the CDC for over 20 years helped shape the field of violence prevention and understanding the causes and consequences of domestic and sexual violence. The award's review committee of experts felt really strongly that this year's award recipient, Dr. Nkiru Nnawulezi from the University of Maryland, Baltimore County, really embodied the legacy of Dr. Saltzman. So the review committee echoes the sentiments of the person who nominated Dr. Nnawulezi, who shared that Dr. Nnawulezi's scholarly work is consistent with Dr. Linda Saltzman's career, and that Nnawulezi's research is breaking new ground, challenging our research community to explore gender-based violence in novel ways, and is truly integrating practice and research towards significant and sustainable solutions for marginalized gender-based violence survivors. So with that, I would like to welcome Dr. Nnawulezi. Thank you for joining us today.
Thank you so much for having me. I am so grateful to be here with you. Thank you, thank you.
Yeah, we are happy to have you. So I wonder if we can start by, if you could just tell us a little bit about yourself and your work.
Yeah, I would love to. Thank you, first of all. I am so grateful to you. I am so grateful to Dr. Saltzman for and the incredible contributions that she made to the gender-based violence movement. I'm grateful to the committees that selected me, and it is just really an honor to be here with you today, to be sharing space with you. I'm deeply appreciative of it. So a little bit about me. I come to you as a Black feminist, right? Which means that I focus on how identities and lived experiences and our histories, both individual and collective, and the experiences that we have with systems of oppressions all shape where we are in life and also what we have access to. I also come to you as a community psychologist, which means that I believe that individuals cannot be well and healthy unless our systems are well and healthy. And so a lot of the work that I do isn't solely just focused on changing individual survivors' thoughts and feelings and behaviors, which are important, but also, and maybe what I prioritize, is making sure that we're changing the conditions that survivors are situated within. As a Black feminist community psychologist, I seek to architect systems that transform survivors' material and social conditions. I do that in two different ways. I'd love to talk about that. The first way that I do that is I study what is. What I mean by that is I work within systems to figure out how can we make things more equitable, right? How do we increase survivors' power? What is it that survivors are saying isn't working for them within these systems, and how can we shift and change that? In response to that work, I've been able to look at the role of rights-based norms, right? The idea of everybody has a right to housing, everybody has a right to income, everybody has a right to choose who and what they engage with when they want to. Having norms like that can be really useful in particular programs and institutions and systems. I've looked at low barrier policies, the idea that people should have the ability to access services no matter what they might be bringing to the organization. And I've also looked at the ways in which we think about voluntary service policies, right? The choice to engage in services in the ways that feel good and are supportive of them. And I've looked at a lot of the way, in order to think about trauma-informed care, I looked at the role of relational cultures within organizations, and how important it is for providers to know that they're in spaces where they're going to be supported and cared for, right? And in connection with other people, and how all of those things I just mentioned all support survivors leaving organizations, leaving institutions, leaving systems, saying, I feel like I have more power. I actually have more power. I feel good. And I feel more safe. And so those are the things that the one way as I work within the system that I'm really invested in. The other thing that I do is I provide evidence for what could be. What I mean by that is I support communities who are working, community members and survivors who are working around the clock and deeply with people to find alternatives to systems that have failed them over and over again, right? So what does it look like for us to build out alternatives to systems? I do some work with an organization where I am in DC, where we're looking at transformative justice models and approaches to support survivors who can't rely on the carceral system to keep them safe. So all of these things are these two ways, right? Studying what is and studying what could be are how I contribute to shifting material and social conditions for survivors.
Yeah, thank you so much for sharing that. I love so much of what you shared, and especially, you know, bringing in our identities into the work and how important that is. And I love what you also said about how we cannot be healthy until the systems around us are healthy. I think that's so important, you know, to really bring into this work. So thank you for sharing that.
Yeah, thank you. I feel like so much of what I do is rooted in this transformative, participatory, community-based approaches, right? So so much of what I was learning and doing this work is that it didn't actually matter sometimes how many individual interventions that I was supporting or I was, co-developing with people. Sometimes there's just not enough housing, right?
Yeah.
Sometimes the incomes are just not high enough for people to be able to get what they need. And so what does it mean when you're in relationship with people and you're building out studies, you're building out interventions, you're building out policies with people, that we really focus on shifting and changing the conditions rather than just the person.
Yeah, absolutely. And I love how that really shifts the power dynamics too when you're doing research. So I love that.
Absolutely.
So I'm also wondering if you could tell us a little bit about what got you interested in this work.
That's a great question. So many things, but maybe one of the things that I'll share. So I entered in this work probably how a lot of people entered into this work, by witnessing what was not working and who was left out. Right? So at the beginning of my career, I worked in a domestic violence organization, I worked in a rape crisis organization, I worked in a human trafficking organization, and in all of these spaces and all of these experiences, I was listening to people's stories. I was listening to what people needed. I was listening to the limitations. I was also listening to what was working, but all of these things led me to conduct a study, one of my first studies, about anti-Black racism within domestic violence shelters. And the specific form of anti-Black racism that I was looking at was racial microaggressions. And this study really illuminated a number of things for me about how systems worked. But specifically, survivors talked about kind of interpersonal experiences of discrimination, but more than that, they were talking about how aspects of the shelter environment really kind of reified white dominant norms, white dominant ways of being and thinking. And those things, those aspects of the environment was really actually what made their stay in shelter difficult, right? Their stay in shelter not supportive, or what felt really disempowering. And so that is what kind of contributed to my, the environment, right? Like, this whole experience, this is all a part of it. And then I remember after I was sharing those results with a group of Black women who had survived violence, and the findings like really resonated with them. They were like, oh my gosh, yes, 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 that's how I experienced it. That's true for me, which is always a powerful moment, right? When the research aligns with what people are saying really resonates with them. And one survivor in particular shared with me, you know, I just never realized how Black I was until I left my husband. So for her, it wasn't about like, she was surviving a very violent home, but then it was all of the things that she had to experience after she left her home, the way the system engaged with her and treated her that really worsened her health and her relationship with her children. Like it was all such a storm, right? Like the perfect storm, disempowerment. And I think those were the experiences, right? Those were the things that I was like, okay, well, like it's not just, you know, it's the conditions, right? It's the conditions we need to focus on. That's what I really want to figure out how to shift and change.
Absolutely. Yeah. Thank you for sharing that. That's such a powerful example and reminds me of what you're sharing earlier about just how do we make sure that survivors get the care that they deserve and the care that we all need. And so it just really speaks to that.
Yeah. Thank you.
Yeah. So your work also focuses on marginalized and systemically oppressed survivors. And so what are some of the values that you bring to this work?
I love talking about values. That is a great question. Thank you.
Yeah.
So the first value I bring is a focus on transformation rather than simply amelioration. A majority of my studies have been with women of color, if not all of my studies have had samples with all women of color, and more specifically Black women. And Black women oftentimes talk to me about being caught in a cycle, right? Being within the cycles of within systems. They talk to me about the cycles of violence, right? They talk, which we're all aware of. They talk to me about the cycles of intergenerational trauma, and their desire to end those cycles, right? Like, what does it mean for me to be able to get what I need, be able to support my family and my wellness, be able to, you know, sometimes make sure my partner's okay. I do care, you know, like I care. All these things are important. And so what would it look like to truly have systems that transform rather than just respond to the immediate crisis? I think survivors want more, and they also have ideas about how that can happen, which is why I really think participatory methods are important.
Yeah.
So that's one, focus on transformation rather than simply amelioration. And I also want to say, like, I get it. Like, I do get why we put Band-Aids on things, because the problem is so big, right? The problem is really, really big and very immediate. So it's an and both for me. And the second thing I think that I really, really value, particularly we're doing work with survivors with histories of multiple marginalization and stigmatization, is relationships, right? I believe that interdependence is critical for health. Right? So any opportunities that really support community connections, opportunities that really facilitate people being able to co-create with one another, I think is vital, not just for responding to and increasing the power that survivors have, but also allows us to support the health of people, health of communities, health of systems, right? So that feels really important. Relationships, I think, are critical. And interdependence, I should maybe say I value interdependence, that we are reliant on one another, and that should inform a lot of what we do and approaches. I think the next value that I have is about housing being a right. I feel like I have to say that because I think that it's just really important. Housing is a form of prevention, right? Housing, supporting people is a way to make sure that our communities are healthy. Having safe housing and believing that is a right, that it's not something that people have to get ready for, that it's not something that people have to deserve to do. Like, you just get it because you breathe, you know? Like, you just should have housing that is safe because you breathe. And I think survivors over and over again, when they talk about what it is, the women that I speak to, when they talk about what it is that they want, it is peace and stability and home that is comfortable and that they can take care of their families in. And so that guides a lot of what it is. I think that the other thing is that the other value that I have that I think guides everything is that communities should be really self-determining and promoting their health. And this goes back to my use of participatory methods, but people know what they need. They really do. And I think we can find out how to best support people by asking them, right? Yeah. By asking what, and to me, this feels really basic, but I am always shocked by how much we don't do that sometimes. Yeah. You know, how much we don't do that. Just like, what do you need? And how can we figure out how to get that need met? And I think communities can decide, communities broadly defined, but they can decide what it is that they want to support their own health. And I also think in that, wrapped in that, I really value systems thinking, right? So I think that Black women in particular are really, really, and women of color broadly, I think are really natural systems thinkers, primarily because there's been an engagement in the system in different ways. And so they know a lot about how to negotiate different spaces in ways that even like I would never, like I don't get, like I might understand because I don't have to navigate systems in the same way. Right. So really valuing that knowledge, really valuing and understanding the kind of higher order thinking that survivors have to do because of the ways in which they are engaged in different systems.
Yeah, those are so powerful. Thank you for sharing that. And I have to say too that I really see those values coming through in your work when I'm looking at it. So it really transpires. So I'm wondering if you can also talk about a little bit about what you're working on right now.
Oh yeah, I would love to. So I am doing a few things. One of those things that I'm really excited to share is there's a really wonderful organization here in DC, I live in DC, called the Collective Action for Safe Spaces. And they are building out a transformative justice hub for survivors in the city, particularly survivors who are queer and trans, who are survivors of color, survivors who may or may not be engaged in the criminal or civil legal systems in the ways that more traditional survivors might be. And so I'm really proud to be in partnership with them around providing evidence, doing a needs assessment about what it is that survivors would want if there were responses outside of the state available in the city. So I'm excited about that. And I highly recommend people look up their work because they're a powerful group. And the other thing I'm doing is doing a participatory study with people who are surviving violence, have experienced housing instability, and are also living with HIV. And in that conversation and that study, we're building out how do we think about a social ecology of displacement, because there's so many things that contribute to displacement that is the precursor to the instability. Right. And so our discussion is like, are there ways that we just got started together. So now we're just trying to figure out, there's lots of different things that are contributing to people being unstable. So what does it mean for us to take an ecological perspective to thinking about displacement for survivors? So I'm excited about that and I'm excited about that. And then the last thing that I'm doing is in relationship with some folks out in Baltimore. We are developing an intervention for survivors whose partners are in abuser intervention programs. So that particular set of survivors oftentimes aren't going to be seen in our typical traditional domestic violence services. Right. Very few of them actually reach out to formal systems at all. And so we're really excited to figure out ways that we can provide direct resources to survivors whose partners are also experiencing, whose abusive partners are going through a program. So I'm excited. Those are the three studies that make me really happy.
Yeah.
Yeah.
Yeah, those all three sound really exciting, and I'm looking forward to hearing more about them when they're coming out.
Thank you. Thank you.
So I'm wondering too, if you have any advice for people who are beginning their careers in doing research on intimate partner violence.
Ooh, I do. I do. First off, there is so much space for you in this movement.
Mm.
There are still so many questions we need answers to. We need you. You belong with us. Like, I am saying this because I'm specifically folks of color, folks who are trans, folks who are queer, folks who are first generation, folks who never knew that they could be researchers and really thinking about it. We need you. We need you. Your perspectives are really important, and you belong. You belong here. You belong with us.
Like you said, there's just so much more work to be done. So I really felt that, and I appreciate the space that you just made for that.
Yes, yes. Please connect with me like I want. We need you. We need you. We need you. You belong. I think the second thing I would say is that vision-driven work will take you further than project-driven work.
Mm.
What I mean by that is that I highly recommend that you create a vision, sit down, write down what it is that you want, and then do a research program that aligns with your vision, and then trust that things will work out for you. I think that it is what makes my work feel really meaningful for me is that it is led by a vision that I have, and that gets revised over time, but it's a vision for a more free world, and I know we're going to get there. So do vision-driven work. I think another thing I have is we talk a lot, probably, I don't know you, but I feel like there's a lot of discussion about being in silos, and I think the way that the academy is set up is that people have to find their niche and go to it, but I also want to encourage people who are new to the work that you are a part of a larger ecology of people who are working to create a more liberated world. Right? So it's not just you. You're a part of a collective. This is my value of interdependence. Because the problem of gender-based violence is just too big and too enduring and too difficult for any one person to respond to or to have any one approach. So all of us are actually necessary if we want to see a different kind of world. So thinking about yourself as a part of a larger ecology, I think it's important. Research, and the other thing is that research is a really powerful and meaningful tool to gift communities. I love research. I love being a researcher. There's literally nothing else that I was built for this. I really feel like that. I was built to be a researcher. And so I think it's important for folks to get really good at research. If you want to be a researcher, I think it's important to get really good. And also, research has caused a lot of harm to a lot of people for a very long time. So you need to learn that too. You need to learn about that harm, think about that harm, speak about what harm, be well versed in understanding the harm that has been caused. And then you figure out how to do research in a way that repairs and that liberates. And my last little bit of advice is that I really want new researchers to value building deep relationships with people. Just value it, right? All of the abundance that I've experienced in my career, both the tangible and the intangible, have come from the relationships that I have formed with people, with survivors, with mentors, with with my colleagues, like so many different folks. And so value and get good at building deep relationships with people. I think that will serve you your entire career.
Yeah, thanks so much for sharing all that. That is so much great advice for researchers just starting out in the field. And when you were talking about having a vision, it just brought me back to when we were talking about values and being really rooted in values and doing this work. And so, yeah, I just agree that that's so important.
Yeah. I think it's just too hard to do it without being value led. It's just too
Right.
hard.
Yeah, and then the relationship building piece, that feels so important to thinking about what you were saying about all the harm that's been done in research, with research over the years, and it feels like that piece about building relationships is a good, just strong value in not repeating those patterns of the past.
Yes, absolutely, all of that. Yes. Completely agree.
Yeah. So speaking of visions and hopes, I'm wondering, what is your hope or vision for the future of the intersecting fields of anti-violence and public health?
I have so many thoughts, but I'll keep them. I have 4 I want to share with you.
Okay, great.
I would love to see a deeper investment in participatory research.
Mm-hmm.
And particularly community-based participatory research, particularly the ones that are really seeking to transform the conditions in which people are living. I think that engaging survivors, and particularly engaging survivors, right? I think engaging survivors in this kind of work is deep, it's meaningful, and it will have really tangible benefits for all involved. And so I would love for this participatory approach to be one of the more dominant research approaches in our field, because it aligns with so many of the values that we already espouse, so many values that we already believe in. So, participatory research.
I love it. I love it.
I would also love, the second thing is I would love to see our field continue to, because I think we do this, to continue to think really deeply about localized community-based efforts. I think there's a lot of value in getting deep in with people to figure out how to respond to violence and how to eradicate violence in the community. That's really important. We need those possibility models, right? There's some people communities who are doing really powerful work. And so seeing that, valuing that, uplifting that work, I think is critical for us moving forward, and particularly folks who are not using what the field traditionally does or uses, so lifting possibility models are important. And also, it's like, I also feel like there really needs to be a deep investment in structural interventions that actually create more resources for survivors. Right now, DV Housing First and flexible funding are things that I think are really opportunities for us to think about what does it mean to put things into systems that increase the actual tangible resources that survivors have, right? I mean, giving people money really helps, right? Yeah. Giving people money in a system where certain people don't have access to the same amount of income as other people means that giving people money is a really important way to create more equitable access and improve the quality of people's lives. So structural interventions in that way, I would really love to see a deeper investment in. For me, I want to see more anti-carceral options. I want to see more options where people don't have to engage with the police in order to be safe, where people don't have to engage with the police if they don't want to, right? It's a choice in order to get the things that they need. I would love to see more opportunities to expand the options that people have in their communities and not have to sacrifice not being able to get things because they choose not to use the police for that. And I think the last thing is that there are a lot of things that people are saying or doing that probably feel impossible, right? Like, you want a world without police, or you want a world where people have more options, I think that's, I agree, like, I don't believe it's impossible, obviously, but I think it's going to be a big lift. But I think our job as people who have shared values around supporting survivors and creating a more liberated world, our job is to provide evidence to make things feel more possible, right? That's what we do. Yeah. That's the goal. And so I really encourage people to provide the evidence that expands options, provide the evidence that really makes things more possible.
So I just want to close by sharing that if folks are interested in learning more about Dr. Nnawulezi's work, some of her research is actually going to be featured at our conference. So this is going to be Thursday, April 29th at 10 a.m. Pacific time. The conference workshop title is on mandatory reporting laws, help seeking, and radically reimagining an intersectional intimate partner violence response. So Dr. Nnawulezi, if folks want to learn more about some of your work, where can they find that?
Yeah, I would, so there's a few different places. I am on Twitter, so you are more than welcome to follow me at Dr. N Squared. I also have a website at www.drnkirunawulezi.com. I am always happy to email articles. The website has kind of the list of, on the research tab, that's kind of a list of articles and things and other types of publications that I've been a part of co-creating with people. So you can always click that, but if you're also welcome to email me directly for any kind of information. I'm really excited I'm always happy to share work. I'm always excited to reach out to people or to connect with people who might be doing similar work. So those are the places.
Great, thank you. So just want to say thank you so much, Dr. Nnawulezi, for joining us today and having a conversation. It was so great to hear about your work and a little bit more about yourself and especially the values that you bring to your work. And we look forward to hearing more about your work in the future.
Oh, thank you so much. This was such a pleasure. It was such a pleasure to connect with you. And thank you again for this award. It really means a lot to me. Thank you.
Thank you.